Know how to identify patients with nicotine dependence. In this video, you will learn about nicotine dependence. This includes knowing how to identify patients with nicotine dependence, how to support patients with nicotine dependence, how to identify patients with nicotine dependence. First, ask every patient at every visit or admission assessment if they smoke. If the patient is unable to communicate, ask the caregiver about the patient's smoking status. Include a tobacco use history assessment as a vital sign. If the patient is identified as a current or recent smoker, for example, the use of any form of tobacco or nicotine-containing product in the past 6 months, an assessment as per UHN Nicotine Withdrawal Assessment Order Set should include the following: how many cigarettes smoked per day, how soon after waking do they smoke the first cigarette. Smoking the first cigarette of the day within 5 minutes of waking is an indicator of high nicotine dependence and may require higher initial nicotine replacement dosing. Patients who have high nicotine dependence may benefit from application of multiple patches, so they receive approximately 1 milligram of nicotine for every cigarette smoked per day to provide the baseline nicotine level, in addition to using fast-acting nicotine. Document the smoking status of the patient in one standard location in the patient chart as per program protocol. Using one standard location will ensure all healthcare providers can quickly access the information. Be mindful of signs of withdrawal, including nicotine cravings, anxiety, difficulty concentrating, decreased mood, irritability, and insomnia. What to do about nicotine dependence? Offer the patch, gum, or inhaler to patients with nicotine dependence and provide education on their use and purpose. Instruction on how to administer nicotine replacement therapy is presented later on in this video series. Nicotine replacement therapy products are loaded into the Pyxis machine of each unit. If none are available in the machine, use the Global Find function on the Pyxis machine to locate the nearest unit which has the product and inform pharmacy to reload the machine. For patients who do not wish to take nicotine replacement therapy, they can be managed on an individual basis by their interprofessional team. In this video, you learned about nicotine dependence. This includes knowing how to identify patients with nicotine dependence, how to support patients with nicotine dependence,